Hello, I'm Professor Mohamed Khadra and I'm pleased to present you this video on urodynamics. The aim of this video is to help you understand the procedure, its main side effects, and to prepare you better for your upcoming urodynamics. This video is intended to be used in conjunction with the information leaflets you've already been provided. Urodynamics is a procedure that allows us to find out more about your bladder and whether there is a prostate obstruction. And it does this by essentially measuring the pressures and behavior of your bladder during filling and also during the time you empty your bladder. In adults, we normally carry out the procedure using a small amount of local anesthetic gel passed into the urethra. The test is usually performed by a specialist nurse and I'm in attendance. On arrival in the rooms, you'll be asked to pass urine into a device called the flow rate machine to measure abdominal pressure. Please ensure you arrive with your bladder comfortably full. You'll then be positioned on a bed and two small tubes inserted, one into the urethra and the other into the anus or vagina. After the tubes have been inserted, your bladder can be emptied and the tubes connected to the measuring apparatus. If one of your symptoms is leakage of urine, we will try to reproduce this so that we can see what the bladder is doing when the leakage occurs. Patients often find this embarrassing, but it provides important information needed to treat your symptoms. We will do all we can to be as supportive as possible during this process. When the procedure has been completed, you'll be asked once more to pass urine into the flow rate machine. All the catheters will then be removed and you'll be able to get dressed while the results are being analysed. I'll discuss your results and decide what action is needed to help your symptoms after you're dressed. When you go home, I'd like you to drink plenty of water for the first 24 to 48 hours to flush your system through. If you experience flu-like symptoms, shivering, shaking, if you're unable to pass urine after the test, any pain or burning when passing urine, or a high temperature, please contact us or your GP, or if it's really severe, go to the emergency room of your nearest public hospital. Most procedures have side effects, and these range from very common ones to more rare occurrences. But in most cases, patients go through the procedure without any serious side effects. Commonly, after the procedure, you might experience some discomfort on passing urine, perhaps even blood-stained urine. In about 1 in 50 patients, urinary infections can occur, and if the prostate is very obstructed, inability to pass urine or retention of urine requiring temporary insertion of a catheter. The inability to pass the catheter into the bladder requires further investigation. Sometimes the urodynamics fails to give a definitive diagnosis, sometimes requiring that the test is repeated. Hospital-acquired infections are very rare and occur in less than 0.9% of cases. The rates for hospital-acquired infections may be greater in high-risk patients. This includes patients, for example, who have long-term drainage tubes or catheters, patients who've had their bladder removed due to cancer, patients who've had a long stay in hospital, or patients who've been admitted to hospital many times. Urodynamics may not give a definitive diagnosis for your symptoms. Some patients need to have other studies, such as cystoscopy or X-rays of the bladder, in order to allow us to arrive at a proper diagnosis. Hopefully, this video has presented you with an overview of the procedure. You will have already received the patient information booklet, and we've had discussions during our consultations. If you have any questions about any of the contents of this video or the information sheets you've received, then please don't hesitate to contact the practice or to make another appointment before your operation.